All right, good afternoon. I'm Ted Snyder, Dean of Yale School of Management. Welcome to this, our first Leaders Forum of the academic year. The Leaders Forum is a series that brings preeminent individuals from all sectors and regions to the school, and at these forums we address big issues and approaches to leadership. Today we are extremely pleased to have the Surgeon General of the United States, Dr. Vivek Murthy, as our featured guest. I'm very pleased as well that the Dean-designate of Yale's School of Nursing, Ann Kurth, accepted my invitation to engage in a dialogue with the Surgeon General, after which we will have time for questions and answers. This event is being live streamed to the Global Network for Advanced Management, so we have a global audience as well joining us today. Welcome. I'm going to keep my introductions of Dean Kurth and the Surgeon General relatively short to maximize time for the substantive program. Dr. Kurth is the Paulette Goddard Global Health Professor in the New York University College of Nursing and School of Medicine, Department of Population Health. She's also Associate Dean for Research in the NYU College of Global Public Health. As of January 2016, she will be the Dean of the Yale School of Nursing. Dr. Kurth is a certified nurse midwife, an epidemiologist who studies approaches to improving HIV and sexually transmitted infection prevention, screening and care, reproductive health, and global health workforce system strengthening efforts. Dr. Kurth is an elected member of the Institute of Medicine, National Academy of Medicine, and she's also a member of the U.S. Preventative Services Task Force. Regarding her status as an elected member of that task force, we should note that today's presentation and anything she says do not reflect or represent the views or recommendations of the task force. With that disclosure aside, I will just say that everyone on campus is looking forward to having Dean Kurth join us in January 2016. So turning to today's other speaker, our featured guest, Dr. Vivek Murthy. He's a graduate of the Yale School of Management and the Yale School of Medicine. Throughout his career, our speaker has been a leader for business and society. After being nominated by President Obama, the U.S. Senate confirmed Surgeon General Murthy in December 2014. As America's doctor, he is responsible for communicating the best available scientific information to the public about how to improve personal health and the health of the nation. He also oversees the U.S. Public Health Service. The U.S. Health Service Commission Corps. The Corps has approximately 6,800 health officers who serve in locations around the world. Their role is to promote, protect, and advance health and safety. Dr. Murthy has spent his career focused on improving public health through different avenues: education, clinical care, research, and entrepreneurship. Let me provide these highlights. After his residency, Dr. Murthy was on the Harvard Medical School faculty as an internal medicine physician and instructor. As a research scientist, Dr. Murthy has conducted laboratory research on vaccine development and studied the participation of women and minorities in clinical trials. Dr. Murthy co-founded Visions, an HIV/AIDS education program in India and the United States, which he led for 8 years. Visions programs have reached more than 45,000 children. Dr. Murthy also co-founded the Swasthya Project, excuse me if I pronounced that incorrectly, which means health and well-being in Sanskrit. This is a community health partnership in rural India, which trains women to be health providers and educators. He co-founded and was president of Doctors of America. This nonprofit has thousands of physicians and medical students working together to ensure everyone in the United States has access to affordable, high-quality health care. Dr. Murthy has also co-founded and chaired a software technology company trial networks, which improves research collaboration and enhances the efficiency of clinical trials around the world. In 7 years, the company went from a concept to an enterprise that powers clinical trials for over 50,000 patients in more than 75 countries. In his role as Surgeon General, Dr. Murthy has identified the following goals: building cross-sector partnerships in communities to address obesity and tobacco-related disease, reducing the stigma associated with mental illness, improving vaccination rates, making prevention and health promotion the backbone of our communities. These are wonderful objectives. Please join me in welcoming Dean and Kurth and Surgeon General Vivek Murthy.
Well, thank you, Dean Snyder and U.S. Surgeon General, for making this wonderful opportunity available to all of us. You were confirmed in 2014 as the 19th U.S. Surgeon General, one of the youngest ever. So I was inspired by that. I'm sure that some of the younger members of our audience are also inspired by that. Many of this generation are what we call Generation Global in many ways, as you know, who see an interconnectedness to health around the world, both in the U.S. and the globe. Like you, they've started nonprofits and social movements to address pressing health problems. Tell us a little bit about what inspired your route into healthcare, which includes the management side here, of course, and what advice you might have for young people who are looking to change the world through better health for all, which parenthetically is the School of Nursing's tagline at Yale.
Very good. Well, first, I want to say how happy and thrilled I am to be here, to be back home at Yale. I really treasure my time here, both at the School of Management and at the School of Medicine. And one of the things I loved about Yale was just how, as Dean Snyder put it, how permeable the school was, how people flowed between schools and institutions here. And during my time here, I got to meet and learn from so many wonderful people. So it is good to be back. My own path, in many ways, started with my family. My parents, my mother and father, they ran a medical practice in Miami, Florida. My father's a family physician by training. My mother didn't formally train in medicine, but she built and ran the practice that my father still continues to practice in. And as a child, I spent a lot of time in that practice, and that was my exposure initially to medicine. I didn't understand the science, but what I did know at that time, at a young age, was that the relationships that they were building with patients throughout their days were incredibly meaningful, both to the patients and to them. And it inspired me to want to be a part of building such relationships in my future work. But I got my real start in public health actually doing global health work. When I was 17 and my sister was 18, we were young at the time. We were freshmen in college. We really didn't know a whole lot about building organizations or about public health. But we had spent a little time over in India and recognized that they had a major problem with HIV that was not just on the horizon, but it had already begun. And we wanted to do something about that. And we, again, being young, sometimes one of the great things about being young and trying things is that you're not constrained by fixed ways of thinking. You're also not constrained by your experiences or lack of experiences. Sometimes you just go out and you try. And very often to solve problems, that's what you need to do, is you just need to try. And that's what we did, is we decided to build a peer education model where we would train students from the United States, take them to India to conduct workshops during the summers, to not only teach them about HIV and prevention, but more importantly, to mobilize them to go into communities themselves and help educate folks and help them protect themselves. So that's what we did, and we ran it over 8 years, and I won't take you through all the gory details, but there were great moments, there were very difficult moments. I learned a great deal, I grew a lot, and it was a key part of why I came to the School of Management. Because when I began my time as a medical student at Yale, and I had thought that I wanted to practice medicine, but on my mind was this experiences that I had had running Visions, the HIV organization that we built. And I realized that what I loved most about that experience was the experience of bringing people together around a common vision for how to improve the lives of others at scale. And when I thought about the future I thought I want to do more of that. I don't know what issue it'll be around. Maybe it'll be HIV. Maybe it won't even be health related, who knows? But something about that was very exciting to me. And so I came to the School of Management because I wanted to learn how to build effective organizations. And one of the things that I was really fortunate to find was that they had just started a joint MD-MBA program under the leadership of Dr. Howie Foreman, who's here with us today and who remains one of the most important mentors in my life. And fortunately, thanks to that program, I was able to come here. And I'll lastly say that the experience here was, I couldn't have predicted what it would bring. I came thinking that I would leave with management training, but I left with much more than just management training. I left with a broadened perspective that came from interacting with people who were from a different world. They were not from the world of medicine, but they had a desire to improve people's lives. They had an interest in health. And the conversations that we had in class and outside of class had an unmistakable impact on how I looked at the world thereafter. And as I told Dr. Foreman actually over lunch today, I felt that I re-entered the world of medicine seeing opportunity in a whole new light, seeing opportunities to improve processes where I previously would have glanced over them, seeing opportunities to improve patient care where previously wouldn't have occurred to me. So this was all very important to me, my experiences here. And while I went on to do some other things in between, as Dean Snyder mentioned, with a tech company and doing some other nonprofit work, what remained at the heart of my experiences, what really continued to guide me, was an interest that started when I was 17 years old in Visions, which is a desire to build organizations that would bring people together around a set of values and a shared vision for improving the lives of others. And that's why I'm particularly so grateful to have the opportunity to serve as Surgeon General now.
Well, it's a terrific trajectory and philosophy, and I really appreciate the boundary crossing and the richness that you get from that. And something that you said, I think, is your job definition, in addressing complex problems at scale. That's sort of the purview of your office. So let's come back to those priorities that we started to hear. Your office is focused on community-based prevention, and we might want to talk a little bit about what that means. Addressing health and medical disparities, very critical, as we know. The difference in lifespan in subgroups is quite disparate in the United States. Active living program, that's a very unique signature program of yours, and including things like walkable communities, exercise incorporation into people's lives. You've gotten a lot of attention. Your office has got a lot of press on this recently. The mental health destigmatization is really important. And you sort of take it a step beyond to also address emotional well-being, which I think is very holistic. And not just at the individual level, but the community level. You talk about community resilience, and that's sort of an asset-based, strengths-based approach. Tobacco, obviously, you've addressed substance use and abuse, including prescription drug abuse, and there you're sort of working with the provider community as one of the drivers, and points at which we can leverage reduction. Violence, you've talked about as a public health problem, and particularly violence against women as well. So do you want to sort of amplify on some of these themes?
Sure. You listed a number of issues, and that's accurate because
it's broad.
As you know, our country faces many challenges, and the world is facing many global health challenges. So it is both expected and necessary that our plate is full of many issues. But I want to help you understand a little bit about how we think about these issues, how I think about them through a even more simplified lens. One lens, and an important centerpiece of what I want to do as Surgeon General, is to help build a culture of prevention in America. And what does that mean? Well, we spend the majority of our time and resources in treatment of illness. For that reason, we have some of the best treatments in the world, some of the best facilities in the world. But we spend relatively little of our resources on preventing illness in the first place. We know that that makes more sense from the standpoint of reducing suffering and reducing cost. But the question is, why don't we do that? Why don't we allocate resources to prevention as a country, really as a globe? And there are many reasons for that, and I'm happy to go into them in some of the Q&A if you would like. But when I think about building a culture of prevention in America, there are three core components of that. One is creating a culture of physical activity, of active living. The second is ensuring that people have access to good nutrition. And the third is ensuring that we are doing everything we can to support emotional well-being. This last piece, emotional well-being, sometimes can get cast aside as something that's soft, something that people need to do on their own. But it couldn't be further from the truth. Because I'll tell you that emotional well-being is the fuel that allows us to do so much of what we need to do in life. It's what allows us to have the energy and motivation to succeed at work, to pursue new paths of education, and even to take care of our own bodies by choosing the right thing to eat or choosing to live an active life. When people run low in their emotional well-being, when their life is instead dominated by stress, then you start to see reductions throughout their life in health, in their productivity at work, in the fulfillment of their relationships. So building a culture of prevention, to me, means strengthening our ability to deliver on these three areas of active living, nutrition, and emotional well-being. Now, there are other areas that we have to focus on as well. As Dean Kurth talked about, we have tobacco as an issue that the Office of the Surgeon General has worked on for several generations now. We have growing problems with prescription opiate abuse, an epidemic that's ravaging small towns and big cities all across America. There are things that we can do to prevent these as well, but I always think about how to anchor our work in that culture of prevention, because that's ultimately what I believe we need to build in America. And speaking to the role that all of you have in building that culture of prevention, I want to, for anyone who harbors this idea, I want to disabuse you of the notion that building a culture of prevention is something that is solely the purview of doctors, nurses, and public health people, because it's not. It turns out that some of the most important people who need to be engaged for us to build a culture of prevention in America and around the world are in fact leaders in business, leaders of nonprofits, of for-profits. If you think about it, people spend a third of their life or so at work. The environment at work impacts the nutrition choices people make. It influences their choices about whether or not to be physically active. And we know that programs at work, that education provided at work, can have real, substantive, material impacts on the health decisions that people make. But even beyond the workplace, which my hope is that you can help make the workplace the foundation of health, even beyond that, the voice of business leaders is important to making health a priority in our decision-making and our policy-making as communities and as a country. When legislators are thinking about whether to vote yes or no on a policy, when they're crafting policy that may impact health, they may hear from folks who are advocates who care deeply about health. But I believe they need to hear more from leaders in business. They need to understand that you understand that health has a very direct and important impact on your mission, on your bottom line, and on your ability to run a successful enterprise. That is true not just for leaders in business, but it turns out that transportational professionals have a role to play in health and creating walkable communities. It turns out schools and educators have a very important role in health, given that kids spend so much of their life and make decisions about nutrition or activity or lack thereof based on what's available to them at school. When you understand it in this context, you start to see that health is a common thread that weaves through everything we do. It's what I think of as really the engine that enables us to do all of the things that we want to do in life. If we don't have health, really we don't have anything else. It's the starting point. And that's why all of us have to have a role to play in improving health, whether it's for the community that we support at work or for the community that we live in through public policy and decision making.
It's wonderful. Yeah, moving the needle on prevention is really so needed in the U.S. As you say, the chronic disease burden is tremendous, and so much of it is preventable. So you're thinking of this in a very multi-level way, and do not just deal with individuals, but the community and also structural issues. Your office has also talked about cross-sectoral partnerships. So you've mentioned the business world and the role it can play. How are you putting those sort of cross-sectoral partnerships together, and what's working well with that?
Well, it's a great question. And these cross-sector partnerships touch on what I mentioned earlier, which is that we need the participation of sectors across the board, not just the traditional health sectors, in order to build a society that's firmly grounded in prevention, where everything supports health. And we started to do that already through some of the initiatives that we built. So just a few days ago, we released a call to action on walking in walkable communities. And this was very interesting to me because if for some people, like when you hear about walking, you might think, well, it seems kind of dull. What does that have to do with health? It seems not so interesting. But it turns out that walking is one of the most powerful things that we can do as a society to help roll back the tide of chronic disease that we're facing. And what do I mean by that? Well, diseases like diabetes, like heart disease, like cancer, account for 7 out of 10 deaths in America. They account for 86% of our healthcare costs. They cause untold suffering to people in America and increasingly all over the world. If we want to, sometimes we're used to thinking that really complex problems have to have complex solutions. But sometimes that's not always the case. Sometimes the solutions we're looking for can be sitting right under our nose. And it turns out that one of the most powerful things we can do to reverse this trend of chronic disease is something we've been doing for millennia, and that's walking. And by walking, I mean not just walking with your 2 feet. Well, it also means wheelchair rolling. It means walking with a cane. Getting physically active, restoring and reclaiming a culture of physical activity is one of the great tasks that sits before us. And when we launched this call to action, we thought about cross-sector partnerships as part of that. So what we did is we built partnerships with Johnson & Johnson and with a consortium of companies that Johnson & Johnson oversees in order to get them to make commitments to improve opportunities for activity in the workplace. We also built a partnership with the International Society for I forget the acronym exactly, but we built a collaboration with the International Mall Association, which is essentially an organization that oversees all of the shopping malls across America, and actually to some extent around the world. And one of the things, and you might think, well, why did we collaborate with malls? What do malls have to do with anything? Well, it turns out when it's incredibly cold or incredibly hot in your area, we're better to walk than a mall because they're air conditioned. There's lots of things to see, around you. You can do it with other people. It can be a social event. And there's a growing culture of mall walkers in America now. Yeah, believe it or not. So one of the things that the Mall Association is doing is actually to help accelerate the move to get malls all across the country to develop walking programs so that they can welcome mall walkers, help people see that weather does not have to be a barrier to you being physically active. So just like this, we have worked with other sectors as well, with Kaiser Permanente in the healthcare sector, with the nonprofit organizations, and with the NCAA, the National Collegiate Athletic Association, on this walking initiative. But this is emblematic of what we want to do in every other sector. When we launch our nutrition initiatives down the line, you can be sure that we'll be looking to work closely with employers, which through the food that they offer in the workplace can have a major impact on people's health. As we build out our mental health campaigns, we are actually already building partnerships with faith organizations and faith leaders, recognizing that faith leaders have a unique role to play in helping talk to their congregations about mental health and helping to dispel some of the negative attitudes around mental illness, which still, to this day, prevent the majority of people with mental illness from actually coming forward and getting the help they need. So these are just some examples of the kind of partnerships that we'll build. But we don't want everything to be led by us. We're doing this in part because we want to provide examples of how these kind of cross-sector partnerships, when led by and driven by communities, can make an extraordinary impact on health.
That's wonderful. Well, I had several other questions prepared, but I do want to keep us on track so that you all in the audience have this wonderful chance to ask the Surgeon General your questions and thoughts. So we should have 2 mic runners in the audience. And so why don't you just raise hands and we'll try to move around to everyone. And Dean Snyder will sort of manage some of the flow, the questions.
I guess on behalf of the audience, thank you for being here to have this dialogue. It's pretty awesome. So I wanted to talk about that last point you kind of just made with businesses and how you're kind of working with them, especially like Johnson & Johnson. So now when we consider like the demographics that are present, who are the employees of these industries, normally they're demographics that actually do have relatively okay access to healthy resources in both the nutrition department and health insurance and a number of other, like, I guess, factors that they can easily access. But one of the bigger problems I believe that occurs in this nation is the fact that we have like those on the lower socioeconomic strata that don't have great access to nutrition because the income levels that they have don't normally give them the decision-making like power to decide on like what is like the most healthy thing I can buy versus what is the most cheap thing I can buy that can feed my family. So what are you planning, or at least what is the office planning on doing to, I guess, get the word on how to be a better active shopper, or at least a better active nutritionist at that level, so they can actually access the nutritional content that they need to help both their family and themselves?
It's a very good question, and it's about nutrition. Your question touches upon several things. One is, how do we ensure people know what's healthy and what's not? And second, how do we ensure that they have access to healthy foods? Access determined not just by affordability, but also by geography. As we know, there are a number of people in the country who live in areas which are food deserts, where even if they're willing to drive, they have to go 10, 20, 30 miles to find a store with fresh produce. So there are a few things that we're working on, and other things more broadly that I think we have to do as a community. One is that one of the things that we're doing is to help shine a light on examples that are already happening in communities where people are coming together to help teach folks about nutrition and about healthy eating. One of the programs that I'm thinking of right now was in Roanoke, Virginia, a program we ran across called the Healthy Chefs Program, where they realized early on that you couldn't get kids to eat healthy unless they actually knew what fruits and vegetables were. And a lot of kids can't even identify basic fruits and vegetables that you may take for granted. But they also realized you had to go beyond just showing fruits and vegetables to kids, but you had to allow them to touch and feel them, and then to do something with them, like prepare an actual dish. So that's what they did. And the Healthy Chefs Program, over time, surveyed kids as well about what their preferences were. And in the beginning of their surveys, they found that the big three were always on every kid's list. The big three being, and you can probably guess what they are, but hot dogs, pizza, and macaroni and cheese, right? Those three. Those three might be on your list too, but I won't ask for a show of hands, so we won't embarrass anyone. Toward the end of the program, when they checked again though, what they found is that the big three hadn't disappeared entirely, but in many cases they had been replaced by other dishes that the kids had tasted and helped to prepare in the class. And then something else happened, which is the kids would then go home and ask for that food at home. And their parents would say, well, I don't know what this is. We're not sure how to prepare it. But the school was prepared then to be able to tell parents then how to prepare those foods, where to get them at affordable prices, and to work with them to then provide those meals at home in addition to school. Programs like that are helping to not only educate kids, but educate parents. They're helping to drive them toward affordable options. But there are other programs as well. You may be familiar that in the recent Farm Bill that was passed, there was funds set aside for what we essentially think of as healthy food incentive programs. And some of these have been called like double dollar programs as well. What they do is they allow food stamp or SNAP recipients to get double their dollars worth when they use their food stamps at farmers markets. The idea is to increase the affordability of fresh fruits and vegetables. And so far, and a few weeks ago, I had the opportunity to visit a farmer's market in Detroit, where I saw one of these double dollar programs at work myself. And the results have been really extraordinary, which has been that as they've studied it, they've seen that there has been a dramatic increase in the consumption of fresh fruits and vegetables. It's also helping to support the local economy as more local farmers are now coming and sharing their produce. And it's also providing an opportunity for a different and even richer form of social connection. And just out of curiosity, how many of you in this room have been to a farmer's market before? Yeah, almost everyone. How many found them to be sort of fun, interactive, festive places to be? Yeah, most people as well. And they are. And for many people, it's a community experience to go to a farmer's market. You get to actually talk to the person who grew the vegetables that you're about to purchase and then prepare for food. So in these ways, part of what our office is seeking to do is to identify programs that are working, to shine a light on them and share them with other communities so others can replicate those as well. And what we're also seeking to do is to help educate not just communities but policymakers as well about the importance of good nutrition so that programs like the Double Dollars program that we discussed can be supported and ultimately other new programs that support good nutrition can be built and expanded as well.
Hi. Thank you for being here. I'm curious about the constraints that you face in your work because I think you're in a position that could be seen as having a lot of power and opportunity. And I'm curious, kind of day to day, what do you see? Is it if we only had unlimited money or time or personnel or fill in the blank? Like, what is it that actually limits you from having a greater impact? Or what are the things that you're kind of pushing against constantly? And then kind of on the flip side, what opportunities or what power do you feel like you do have because of the position you're in to make the changes that you're working on?
Well, good question. The position of Surgeon General is really an extraordinary position, and I feel very blessed to have the opportunity to serve in it. One of the reasons that it's extraordinary is that there are any number of things that one can do in this position if you choose to do it. So for example, you can choose to go out and educate in the community about public health. You can choose to shine a light on ideas that are working and help make them accessible to more people. You can work with policymakers to help them understand some of the critical issues on health that are affecting the community. You can broker partnerships across sectors, as we are seeking to do, that can build new unforeseen programs and innovations that can help power health forward. There are any number of directions in which one can take the office. The office does not have legislative authority, so I do not make policy and I do not make regulation either. But in terms of education, in terms of convening, in terms of working with policymakers and regulators, there are ample opportunities there. When I think about the first part of your question, is there one thing that if the country had more of would allow us to succeed when it comes to health? I'll tell you one thing, it's not money. And money, I think, is the natural instinct to go to because we're always worried that budgets are falling short, that we don't have enough resources to fund X, Y, and Z programs which have been shown to be helpful. And don't get me wrong, money is important. And our allocation of resources has to reflect our values and our priorities, and health should be at the top of that list. But that said, I think the thing that is even more valuable than money is collective will. And what do I mean by that? Well, collective will is really based on belief. It's based on the idea that we believe we have the power to change things for the better, and we are willing to come together with other people to make it so. One of the concerns I have when I travel around the country and I hear from communities and individuals is that people have lost that sense of individual will and collective will in many, many places. Many folks I talk to feel that their health is no longer in their hands, but it's being driven and determined by forces that are far bigger than them, whether it's by pharmaceutical companies or insurance companies or the food industry or the government or their employer or whoever it may be. But they feel they've lost a sense of agency. But I believe that our ability to build a healthier country and a healthier world will be directly related to how effectively we can rebuild that sense of agency. If we can enable people to believe that they have the ability to improve their health, even if it's in a small way, if we can empower people to come together to advocate for the kind of changes and programs and policies they need in their communities, then I think we can go a long way. Because while we know that things like walkability impact health, while we know that access to healthy nutrition impacts health, how many people are raising their voices to call for more walkable communities, to call for more affordable nutrition, to call for a greater culture of prevention that's reflected in our policies across sectors? Not nearly as many as we need. And so that's what I believe is ultimately going to be at the heart of our ability to succeed as a country when it comes to improving health.
Hello, Dr. Murthy. I'm one of your commissioned officers, one of the 6,800 commissioned officers. I'm a recent graduate from the Yale School of Nursing, and I was commissioned while I was at the School of Nursing. I wanted to take this opportunity to ask you this question because I wasn't sure when I was going to see you outside of this kind of arena. I know you're a busy gentleman. So I'm one of your 800 public health service officers who serves in the Bureau of Prisons. I'm a nurse practitioner, primary care provider in a federal facility here. I thought maybe I would ask you if you'd be willing to open a conversation about incarceration medicine. President Obama is particularly interested in talking about the criminal justice system, and I think it's important to link the criminal justice system to healthcare, especially when it comes to stratification of healthcare. We know that people who come out of incarceration settings do have poor health outcomes. Just some examples are, okay, well, I did write some notes down, I have to admit. So as public health service officers, our mission is to obviously, promote and protect the health of Americans and do so in an ethical manner. The prison system really does test this mission like nowhere else can. We're really fighting an uphill battle in the federal prison system here. We have inmates in solitary with mental health disorders. We have inmates who are limited to really poor dietary choices. We have diabetic inmates who are unable to have regular blood glucose checks and unable to administer insulin as needed just because of the hazards of needles and sharps. We have inmates at risk of substance abuse, and we're unable to administer Narcan, the reversal of opiate overdose, because of the sharps again. I know that you've taken on board historically public health issues traditionally outside of quote-unquote health, like violence, like substance abuse, like gun control. I would ask you now if you could please start addressing incarceration health and correctional health, because you are the voice, and I know you have no policy sway, but you do hold the megaphone for public health, and if you started talking about it, then maybe there would be more policy changes for healthcare in our correctional settings. So would you please take the mission? Thank you very much, and thank you for, I'm really honored to serve under you. Thank you.
Well, thank you so much. And tell me your name.
I'm Junior Lieutenant Helen McGregor.
Wonderful. Well, listen, thank you so much for that question, and thank you so much for being a nurse and part of our commission corps. I have a lot of great respect for nurses, not just because I'm sitting next to a nurse leader, but also because when I began my medical career, it was nurses who helped me so much, as they do for residents all across the country. They helped me a great deal. They became mentors, they became friends, they became supporters. And I remember this when I went to the commission, became Surgeon General and worked with our nurses in the Commission Corps. Part of my great respect for nurses is what led me to choose Admiral Sylvia Trent Adams, who's one of our senior nurse leaders, as the Deputy Surgeon General for the United States. So I very much appreciate the work that you are doing. The point you raised, let me just say a couple quick points about incarceration, and then I appreciate the input, and we'll certainly keep that in mind. I have a couple of concerns when it comes to our incarcerated populations. And this stems from some of my own experiences and talking to dozens and dozens of our Commission Corps officers who work in the Bureau of Prisons. One is that we still, when it comes to addiction, we still treat addiction too much as a moral failing, and we tend to criminalize it, as opposed to looking at addiction for what it is, which is a chronic illness that deserves and needs treatment. Our failure to see addiction in that way leads us to put people in prison more often than not who, more importantly, need to be in a treatment facility. It leads to problems and once folks are actually in facilities, and it often isn't always easy, as you noted, for them to get the care they need there. The other concern I have, though, is around mental health. We know that there are a substantial portion of people in our prison facilities who suffer from mental illness. We know that it's not always easy for them to get the care they need. When I was in Orlando a few months ago, I met with the mayor there to talk about public health issues. And one of the things she told me was that recognizing this problem, the city had actually built a collaboration with mental health providers where they were working to screen people as soon as they entered facilities, as opposed to waiting for something to manifest later on. Now that's one step to moving closer to early detection and to treatment, and we need to keep moving up the scale so we're getting to people earlier and earlier. But those are two big concerns that I have now when it comes to our incarcerated citizens. So this is an area we will keep in mind, certainly as we address addiction and mental health, and I thank you so much for raising it.
Yes, thank you, Surgeon General, for coming. Today's a pleasure and an honor to have you here. In general, I think I'm very inspired by your message in terms of it being very focused on prevention and awareness. And in particular, she may beat me to the punch, but I'm a second-year MBA student, and we're doing a fundraising and awareness campaign for mental health here at Yale and at School of Management in the next month. And one, I was wondering if you would support that, and two, how in general
Are you asking me to pull out my wallet?
that works as well. How do you recommend communities take charge and do this from within, as kind of what you're suggesting that it lies within the individuals to do this?
Well, first of all, thank you for the work that you are doing here in the community on mental health. This is an area where we need really all hands on deck to help, because part of what we're dealing with is changing attitudes and changing beliefs that many people still have around mental health, beliefs which are not helpful to us getting people talking about mental illness and getting the care that they need. So I thank you for the work that you're doing. You asked, what can communities do to actually address this? What can they do in their own spheres? Well, one thing that we can do is we can start to think about what our spheres of influence are. So if, for example, you are the CEO of a company, or if you're an employee within a company, and you have a captive audience of employees within your business who, statistically speaking, are either affected directly or indirectly by mental illness. And one of the things that you can do is you can help to encourage conversations around mental illness. You can have educational materials and opportunities for people to learn more about mental illness. You can have opportunities for people to talk about the experiences that maybe their families have had, to bring people together. And then you can help direct them to treatment. Even alerting people to the fact that behavioral screenings are now available to them through their health insurance plans without cost sharing, without copays. Even that is a valuable service that employers can provide. So as we think about our own spheres, there are things that we can do. If you're a student, for example, and you're trying to think, well, what can I do as a student? Well, mental health is very much a concern and an issue for student populations, undergraduate and graduate populations. Unfortunately, the similar stigma that applies in the general population also exists on university campuses, where a lot of people don't feel comfortable talking about the illnesses that they have. But there are similar education efforts that we can do and engage with on campus that can help to dispel that notion of mental health as something that we need to hide and push away. The third thing I'll just mention is that regardless of whether you're a student, a business leader, an educator, or in whatever sector you work, all of us have elected leaders, leaders who make policy, leaders who help inform regulation, leaders who very much need your input and your perspective as they're making important decisions. And what I would say is that all of us have a responsibility to speak to our elected leaders and share our experiences with them, as well as our ideas. If you're a student on campus who sees large unmet needs when it comes to mental health, then talking to your leadership on campus and raising this as an issue with your deans and with the leadership of the university as an issue that needs to be targeted is good, but also raising it with your elected leaders is something that's important as well. Too often people assume that if they reach out to their elected leaders, that their input will end up in the recycling bin somewhere, that it won't really have an impact. But I will tell you, as somebody who spent much of my life in medicine, in business, not in the world of policymaking and advocacy until much later, that I was surprised at just how much elected leaders want to hear from professionals who have experience and an informed perspective. So more people want to hear from you than you think. And so my recommendation to you would be to think about your sphere of influence and the kind of education and access that you can provide to people in that sphere, but also to not neglect speaking to your elected leaders as well, because they need to hear from you about the kind of policies you need to help our community.
Thank you both again for being here. It's a great pleasure. Dr. Murthy, I'm struck by something you mentioned at the beginning of your comments, that being the relationship you saw between your father and the patients that he saw in his practice. And I'm thinking about the changing healthcare landscape, and I'm wondering what your thoughts are in a world where there are more different types of providers out there and patients are receiving their healthcare in more different types of venues, and CVS is offering a minute clinic option. And as things are changing in the world and people get their healthcare new in different ways from new and different types of organizations, what does the relationship start to look like in this century between patient and provider, and what's changing and what's staying the same?
This is a very good question that's on the mind of lots of people. People who are patients, people who are healthcare providers. And I don't think anyone has a crystal ball about what the future will look like, but I'll share a couple of thoughts. One is that I think that the relationships that I saw developing between my parents and their patients, I think that those are still invaluable today. I think that if we lose relationships, strong relationships that are grounded in trust between patients and their providers, then we have lost something that's really vital and important in the healing process. You can't replace those relationships with apps, with technology alone. Technology can do a lot, but it can't always replace trusted relationships. So we have to maintain and build those. The second thing I'll say is that these relationships are important as well, because even though we have more ways of connecting with each other through technology, my experience has been that people are in fact more and more isolated than ever. They have hundreds and hundreds of friends on Facebook, but nobody to actually hang out with on Friday night. They have lots of connections on LinkedIn, but nobody that they would actually trust to build a business with. Friends in the technology space, connections and relationships are different. And I think that's something that we have to be mindful of as we apply technology to healthcare. And then the third thing I would say is that if we want to maintain trusted relationships, if we want to do so in the face of changing infrastructure in healthcare and changing technology, that means in part we have to rethink what the role of healthcare providers are. So for example, if I'm going to the Minute Clinic at XYZ location to get my flu vaccine here and there, or to get seen occasionally for urgent care for a sinus problem, is that the entire source of my care, or do I still have somebody who's helping to understand who I am as a person, what my needs are, what the social context is in which I live, and then help me make decisions about my health when it's difficult? And I would say that we still need that person, in our lives. And it could be, if I'm a physician, I am a physician, as it turns out. But if I'm a physician who's emerging from training today, and I'm thinking, what is my role in healthcare going forward? I would put the creation and the sustaining of that relationship with patients at the very top of my list in terms of my most important role. There may be other things that may change. I may or may not be the person who administers the flu vaccine to every patient. I may or may not be the person who places a PPD to check if somebody has been exposed to tuberculosis. Things may change around the margins there. Who I work with may also change. I may start working more in teams of people, with nurses, with PAs, with physical therapists and others, as opposed to working solely in my own practice with no one else. Things may change in terms of the services I'm delivering, the setting in which I'm delivering them, and with whom I'm working. But at the heart of being a healthcare provider is that relationship. And I believe that as much as technology will improve, that our need for trusted relationships that we can rely on to help guide us in our health, that need will always be there. If we keep that as the center point, as the focal point of our calling as healthcare providers, then I think we will be guided well. It will help us prioritize what kind of changes we accept, versus which ones we push back against. And I would say the changes which dilute and weaken our relationships with patients are the ones that we should fight most fiercely.
One last question. How about right in the front?
First of all, thank you both for being here today. It's really nice to have this kind of discussion with y'all. Dr. Murthy, you've talked a little bit about how your experiences in global health have affected your path to becoming Surgeon General. So I'm wondering, do you see the role of the US with respect to the global health arena changing in the next 10, 20, 30 years? And if so, how?
Well, thank you for asking that question about global health. Global health is where I started, and it's still very, very important to me. And it will be something that we build into my work during my time as Surgeon General. But I'll tell you why. It's because in 2015, what we know now more than ever before is that domestic health is global health. That the things that happen in countries all across the world regarding health have an impact on us at home. Now, we saw this firsthand recently with the Ebola outbreak in West Africa. And we saw the impact that it had on us here at home, even with relatively few cases that we had in the United States. But what we also know is that Ebola is just one of many illnesses out there. But it helped illuminate, once again, the fact that the infrastructure for health in other nations is an important place for us to invest our time, energy, and partnership. And this can be challenging because sometimes we think about the fact that we have so many healthcare needs here in the United States. How can we afford to assist abroad when we haven't even fixed our own process here at home? But the problem is when we see them as divorced from each other, and increasingly we need to see them as related. So part of what we need to do to enhance our safety in the United States is to ensure that we're helping to build and support healthcare systems abroad, helping to make sure that we are partnering with and building coalitions with other countries so that we can learn from each other in how to establish cost-effective but safe healthcare systems that can prevent outbreaks like Ebola. There's another piece to this, though, that goes beyond infectious disease. We're used to thinking about things like malaria and Ebola, things which are transmissible, as the things that we have to be worried about, the things that may come to our shores. But it turns out that the growing burden that non-communicable diseases, chronic illnesses like diabetes and heart disease have in other countries, also has an impact on us. Because it turns out that, and you can think about this from several perspectives. One of them is actually from, since we're here at the School of Management, is from an economic perspective. You think about it as a country, if the United States is trying to export goods and services to the rest of the world, who's going to buy those products? Well, I would argue that healthier markets are actually better markets. I would argue that when you have a country that is facing rising burdens of diabetes and heart disease, and is having to divert more and more of its resources to treating illness the way our country has had to do, that weakens that country, that takes away resources that could be spent on products from abroad. So there is an undeniable connection between health abroad and health in the United States. But I'll lastly say this, which is that we have also an unprecedented opportunity for partnership. Because while there may have been discrepancies in the past around communicable diseases, and the burden was much higher in many other developing countries than it was in the United States with malaria, with other conditions like that, when it comes to chronic diseases, the United States is leading the pack, and not in a good way. But other countries are starting to catch up. India, China, for example, are seeing their prevalence of chronic disease skyrocket. And it's deeply concerning. We haven't solved the problem when it comes to building a culture of prevention, and they haven't either. And that provides an opportunity for us to work together, to share knowledge, to build partnerships, and to do something which I really love, which is to put the idea of health diplomacy into action. The notion of using health and the opportunities for a partnership around health as a means of building stronger relationships with other countries, which is something that I believe that all of us as leaders in public health, in medicine, in management are well poised to do.
Thank you. So we're now at the point in the discussion where we wrap up And I wanted to ask my future colleague, Anne, do you have closing comments, thoughts?
Well, Dr. Murthy, you've taken us on a terrific journey from the very intimate level of human relationships between patients and providers that might be happening in an exam room, all the way up to strengthening entire health systems and how nations can interact together to learn from each other to improve health. So I just want to say it's been an incredible pleasure and honor to take that walk with you just for this time together. And we also thank you for your leadership.
Thank you very much.
Surgeon General, how does it feel to be back? Do you have closing comments?
Well, it feels wonderful to be back. I just want to thank both of you for your leadership and for inviting me here. I want to thank our audience for having me back at my home away from home at Yale. And I'll leave you with just a couple of thoughts. One is that I would ask that you never forget the important role that you can play in improving health. Because if our country is ultimately, and our world, is going to overcome the major health challenges that we're facing with chronic disease, it's going to come because people who traditionally aren't involved in health at all recognize and embrace the role they can play in advancing public health. And the second thing that I would ask is that you not wait to get started on improving health. Why do I say that? I say that because we live in an extraordinary time where age does not have to be a barrier to starting to improve the status of your community. It doesn't have to be a pre-qualification to starting to make a difference in the world. I was really blessed when I was young to have parents who encouraged me and pushed me to take ideas and try them out, even if I failed. That's why my sister and I started our public health career very early in life. But what I have seen since then is many, many more folks who are young, who are far more talented and intelligent than I, who have started even earlier and who have made an even bigger impact because they were willing and had the courage to try, to take an idea and to run with it. And so what I want to say to all of you, particularly to the younger members of our audience, is that whether you are still in training or just a couple of years out, while you still may be earning your stripes in some ways, you don't have to wait to make an impact on the world, but you can start right now with the people around you, with the community that you're living in, because you never know when the ideas you have are the ones that are going to transform the country and transform the world. So I thank you again for having me here. It's always good to be back, and I'm very much looking forward to hearing about the extraordinary accomplishments of the students and faculty from Yale and from all of those who have joined us from across the world. Thank you so much.
Terrific, terrific. I have three quick things to say. One, I'm so impressed with the questions. Just so interesting, so many different dimensions identified, issues. So thank you to all of you for joining us. Two, the fact that Dr. Murthy identified Howie Foreman reminds me of the many contributions Howie has made to Yale, our community and society. So thanks Howie, you're phenomenal. And then third, my own personal takeaway was pretty much what you just said, that the leadership opportunities, I really hadn't thought about it. They're so available to people who are not surgeon generals or deans of nursing schools or doctors or public health officials, because health is everywhere. And there's so many opportunities for us to think about how we can contribute to a culture of health. And I think it's a great message for me to take away. So thank you so much. Thank you all. Enjoy the rest of your day. And let's have one more thank you to Dean Ann Kurth and the Surgeon General.